You can start your session, Nitin.
Yeah. Uh, yes, good afternoon, doctors. We welcome you all to this webinar. As you all know, the topic for the webinar is to know more about the missing enzyme in your enzymatic preparation. To shed the light on this topic, we have Dr. Satish Kumar with us. I'll just give a brief introduction about Dr. Satish Kumar. So, Dr. Satish Kumar is a MDS periodontist and implantologist. He has 15 years of experience in implant and perio surgeries. He is a well-known speaker at a lot of IDA events and other events. He has a very successful YouTube channel in name of Kazan Dental. He has more than 50,000 subscribers on his channel. Dr. Satish has authored two books, that is the BDS Launchpad and the Dental Launchpad. He is a very vibrant personality, engaging with a lot of students online as well and offline as well. So we welcome Dr. Satish to this webinar. I hand over the session to you. You can take it forward.
Thank you. So here we are again just before Diwali in an afternoon. We as dentists come to interact. Before even we begin the session, okay, there's something I'd like to tell you. I've realized that whenever there are sessions, whether it's a weekend, whether it's an afternoon, you always see dentists willing to attend and learn more. And it's not just that dentists who are maybe young and just want to learn. There are even senior dentists who are practicing for 15 years, 20 years, always take out time and try and learn more about dentistry. We might be having clinics in the morning, clinics in the evening. Still, we take out those 2 hours or 3 hours in the afternoon to upgrade ourselves. And when you think about it, as dentists, why do we actually do this? Why do we put a lot of effort on learning and upgrading ourselves? So, the basic question, if you ask this to a lot of dentists, the first answer you will get is majority want happy patients. They want to provide treatments of higher end and quality so that their patients are happy with the treatment when they go out. The second is they not just more patients, they also want more income. The reason they want this income is so that they can take care of their family and the surrounding and the people around them. The third point, if you ask why people do it, is they want more satisfaction from the results so that when their patients are without discomfort, are happier with their treatment, they have better satisfaction. When they go outside, among their peers also, among dentists, they are known to provide good quality treatment. So, whatever your goal is, it might be more patients, it might be more money, it might be having satisfaction and respect. The bottom line is we need our patients to be happy. So once we know we need our patients to be happy, is it not important that we know what makes our patients happy? So you might have a variety of patients who would walk into your practice. Some would be extremely old in age. Their teeth might be shaking and they would be walking into your clinic. There might be the young person who would be walking into your clinic who might be an IT professional or a housewife expecting high and good quality treatment from you. The third one might be a small child who would be holding their parent's hand and being dragged into the clinic, either with a smile or slightly fear of what is going to happen next. So when you see these patients, we always try and want to know what do my patients want? What can I do to make them happy? And when dentists sit, the first and common joke we say, मेरे patients को discount ही चाहिए. That is, my patients want nothing but discounts. But forget the funny part aside, I want to ask you, do you know clinics who charge a bomb, a huge sum for the same treatment and their waiting areas are completely packed? Then you know there are clinics who are charging minuscule sums and are finding it difficult to fill their seats or chairs. That means we need to realize that patients always don't look for discounts. Then what? They want good treatment? Have you seen that case which was done 15 years ago with maybe an RC treated but you can't find anything in the canal, or half a GP filled in the canal, and the patient has absolutely no discomfort. You do a root canal, perfect till the apex, and the patient has pain. What does the patient say? वो जो ट्रीटमेंट किया था 15 साल पहले, that was absolutely amazing, no discomfort in it, and the treatment you did perfectly, the patient has discomfort. So patient is not looking for good quality treatment on terms of what we consider ideal treatment. Then what are they looking for? First is function. They should be able to chew. They should not have any discomfort while chewing. That is, function is their first priority. Second, it should look nice. They might not look like Miss Universe or Mr. World, but they want to feel like that. They want their teeth, when people smile, that people should say कि आपकी हंसी अच्छी है, that you smile well. So function and aesthetics are the first two things. And the third and most important thing is less or no discomfort during or after treatment. What are patients most afraid of walking into a dental clinic? Of course, it's pain. Majority of them do not want pain during and after treatment. So if you can give a combination of these three, your patients will always be happy with you. They will refer further patients to you, and that is how your practice will grow. So before we even dwell into it, how do we take care of pain and discomfort? We know that we have been prescribing medicines from when dentistry has started in order to overcome this pain and discomfort. But why does this pain and discomfort happen? Why are we forced to give these medicines? The main reason is inflammation. One is infection, for which you give antibiotics, and the second one is inflammation, where your body has a reaction. It can be a reaction to anything: physical trauma, infection like viruses, bacteria, or even chemical irritants which are there. Now, if you take yourself back to your physiology book days, you would remember that inflammation basically had five signs, that is, heat, redness, swelling, pain. And later they added the fifth one, which was known as functionalacia, or loss of function. In dentistry, we usually deal with the first four, unless it's maybe a third molar extraction or something where the patient is not able to open the mouth, which leads to loss of function. But majority of the times, the chief complaint is pain, swelling out there. Redness at times, yes. Heat at times, yes. So our concern is to take care of this inflammation. Now, are all the inflammation same? No, they are not. There are basically two types of inflammation. One is acute and second is chronic. Chronic is when there is an injury and the body gives an immediate response. This can be in allergic reactions, infections, burn, trauma, if there is a cut, something of that sorts. Chronic inflammation, on the other hand, is something which is long term, which is continuously irritating the body, like you having unhygienic food for long periods of time. You have traumatizing your body, you're not having purpose sleep. So this kind of chronic inflammation can lead to various long-term diseases like cardiovascular diseases, neurological diseases, and in certain cases even cancer. So our primary focus as dentists is on the acute inflammation part. Now I want to take you back before understanding why you should prescribe medicines or should you prescribe medicines. What is inflammation actually all about? So let us look of, imagine you're driving through a road, okay? There is an accident which happens in a side. Once that accident happens, the people who meet with the accident might either call their family, friends for help, or they might call in the police to take care of the area, or they might have called in an ambulance if someone is injured out there. When this accident happens, there are other people who are passing by in the road who see the accident. They would stop their vehicles and they would just sit and watch. Some of them, again, will call their friends to come and watch what's happening. Others would ideally call the police or the ambulance. Now, what does the police or ambulance do? they come and take the injured away and they try and disperse or clean up the area. This is exactly what happens in inflammation. Imagine there is a trauma at a site where there is an injury. There are cells which are in that area which would release certain cytokines or chemokines, which are basically inflammatory cells, to come and close up or heal that site. When they do that, there are other cells which are passing through the nearby blood vessels. These are the plasma cells. They would open up the blood vessels, making it dilated, and enter it into the site, where they would also form clusters trying to clean up or clear up the debris. So what happens is, when there is a lot of plasma cells which enter into this site, you end up having a swelling. Because of this swelling and other irritating factors out there, you end up having pain as well. So this is basically the body reaction when there is an injury or trauma. Now there are two types of mediators. Remember I told you about those phone calls of people calling in their friends? If the cells from the surrounding area are the ones inviting the plasma cells or the inflammatory cells, it is known as cell derived. If it is cells from the plasma which are getting in all the inflammatory reactors, it is known as plasma derived. Your point will be, why the hell am I listening to plasma cell derived and plasma derived or cell derived? Why is this inflammation actually concerned with us as dentists? The most important thing you need to remember is, as dentists, we deal with inflammation day in and day out. It might be a trauma case which might walk in. It might be you have created trauma. Basically, when you extract, what are you doing? You're traumatizing the tissues out there. When you drill to place an implant, what are you doing? You're traumatizing the bone out there. When you give a simple thing like a suture, what are you doing? You're actually creating trauma out there. You're injuring the site. So basically, we know we are causing short-term harm to the local area for long-term gain. Why do we extract a tooth? So that we remove infection. So we are creating short-term damage so that long-term there are no consequences. Similarly with an implant or with a simple suture which you are giving. But we know that we are creating short-term damage for long-term gain. It is like when a parent yells at the child. So the parent knows they are doing something which is long-term good. But what does the child feel? Oh no, I don't want to be yelled at, or I don't like it. Similarly, if you ask patients what is their main problem with dentists, their main concern always is pain during or after treatment. There is enough research to show that, and you personally would have seen it, that patients do not get dental treatments just because of this fear of pain during or after treatment. So what do you have to do as dentists? You have to try and solve it. Remember what we spoke in the start. Happy patients makes us have a happier practice at the end of the day. That is what our goal is. And in this, we have to focus on mainly the inflammatory stage. Can we affect the proliferation? Absolutely not by prescribing medicines. Are we giving drugs or medicines to affect the remodeling? No. Are we doing anything to stop the bleeding out there other than giving a suture or a copac or a collagen or something of that sort? No. So the medicines we mainly prescribe are for the inflammatory phase. And in that, we have to find newer medicines which try and reduce this inflammation. We have one of them, which is Tolib. The advantage of Tolib is it comes with a backing from a pharma company which is present in more than 120 countries. So when you're prescribing this, you're aware that this is not a cheap drug. You're aware that it is not of bad quality. It would provide good relief to your patients. But why would you prescribe something additional to your antibiotics and painkiller? What does it actually contain? It might be from an amazing company. It might be an amazing product. But as dentists, before we prescribe something, we always want to know, ki, what are we giving our patients? If our patients ask, ye extra dawai kyun hai? You should know, right? Why are you giving something better? What is the advantage of it? So the point is, it basically has a combination of four enzymes. First is trypsin. Second, bromelain. Third is rutoside, and fourth is papain. Now let's break down each of this enzyme and understand why should we give it and does it actually make sense to give it. The first is trypsin. If you remember your physiology, trypsin was one of the enzymes which are already produced in your body in the form of trypsinogen. It enters into the duodenum, that's your intestinal region, through the pancreatic duct, where it is broken down into trypsin. So if your body is already producing it, are we having trypsin shortage that we have to inject more trypsin? Absolutely not. There has to be a use of it. So this trypsin basically has three anti-inflammatory effects. First is it reduces vascular permeability. Remember I told you this accident, people on the road are just getting out and seeing what the accident is happening. So trypsin basically says, no, we do not want extra people coming into the inflammatory site. Second, it prevents pro-inflammatory cytokines from entering that area. Third, it causes fibrinolysis. What does that mean? Imagine there is a hole in your clinic tomorrow when you get up, in a wall, and you want to seal it. You would call a lot of people who would get bricks, cement, and they will seal up that patch. Imagine once the work is done, they just dump everything and they walk away. How's your clinic going to look? Bad, right? So once the work is done, you need to clean up that space as well. Similarly, fibrin is useful for sealing up if there is a trauma or an injury. But once that clot is done and its work is done, you want to clean up that area. So trypsin comes in handy out here by doing fibrinolysis of that particular area so that healing occurs faster and the patient has less discomfort. But trypsin is useful. Has someone given it before? Does it even make sense for us dentists to just try new enzymes? If you see, our medical colleagues have already been using trypsin, not just in ulcers or rheumatoid arthritis, even in ocular diseases, they have seen it helps in faster healing. So we have an enzyme which our medical colleagues or peers are already using, and we know it is more advantageous. So what stops us from prescribing it as dentists? Then comes the second enzyme, bromelain. Now bromelain is basically taken out or extracted from the stem and fruit of pineapple. Now why would you do this? Why would you take out an enzyme from pineapple and prescribe it to your patients? Reason, it has a long list of anti-inflammatory action. It prevents the prostaglandin secretion. It reduces PGE2. It inhibits bradykinin. There are certain mediators. Remember I told you cell mediated and plasma cell derived mediators. It prevents excessive creation of those mediators by reducing tumor necrosis factor alpha and interleukin 1 beta. Other than this, remember in the first trypsin I told you it breaks down the fibrous parts, fibrinolysis. Bromelain sees that initially when the clot is happening, you do not want excessive clot formation out there also. Yes, you want to control bleeding, but anything in excessive is not useful. So bromelain tries and prevents platelet aggregation beyond a point out there. So it prevents inflammation at the start itself. And like trypsin, bromelain has already been used by the medical field. It has been studied in sports injuries and in acute inflammation. There was a study in which they prescribed bromelain before a procedure when someone was suffering from a sports injury. And post procedure, they saw that the healing and the inflammation was less. So again, we have an enzyme which has been proven to be beneficial before. The third enzyme is rutoside. Now rutoside comes from buckwheat, tea and apple. So again, natural sources. Now rutoside, similar to bromelain, has a long list of anti-inflammatory action. It prevents platelet aggregation, decreases vascular permeability, similar to what we spoke about in trypsin. It does not let the cells enter into the plasma cells enter into the inflammatory site. It improves vascular flow, basically clearing out all the debris which was formed. It strengthens the capillaries. It combats free radicals and similar to bromelain, reduces interleukin 1 alpha and tumor necrosis factor beta which are basically mediators for inflammation. Similar to the two enzymes previously, rutacide has also been given before, and they have seen it in diseases like arthritis. It helps reduce inflammation and is useful. Now, the first three enzymes we spoke about can be found in other drugs as well, which are available in the market. But the advantage of Tolib is in papain. You will not find other enzyme combinations in which there is papain plus the remaining three. Now, why would you depend on one extra enzyme when you already have three enzymes? So this papain is basically taken out from papaya plants. So if you have seen a papaya, when it is raw and hanging on the tree itself, they give cuts. There is a whitish fluid or latex which comes. From that they derive this enzyme called papain. And papain has a longer list of anti-inflammatory action even compared to the previous three enzymes. So imagine you already have a combination of three and you're adding a fourth one. So this has strengthening of blood vessels, anti-inflammatory effect by reducing the histamine and prostaglandins, that is the cell-derived mediators. It has antioxidant properties, and similar to the rest, it helps improve the microcirculation by strengthening the capillaries out there. Papain also has been proven to be beneficial for our medical colleagues. They have tried it in sport injuries, foot ulcers, leg ulcers, pressure ulcers, burns, and even in post sports injury cases. They have seen whenever papain was prescribed, there was better healing and less inflammation post procedure. Why are we not giving one enzyme but four? I'm sure you're already aware of the concept of synergy. Why do you give not just amoxicillin but amoxicillin clap? Because together they can fight other bacteria which are cannot be fought by only one of them. Similarly, synergistic effect is when you give all four enzymes together, they have better action. That is the action of all what we discussed previously. That's better inflammatory response, reduces capillary permeability, cleans up the fibrins out there, improves blood circulation. So the synergistic effect is basically the effect of all the four enzymes in that particular area. Now we have got the advantages of the four enzymes and the advantage of each enzyme. We also found out that dentists might have not used it, but doctors have been using it before. But as a dentist, you will always feel, डॉक्टर ने यूज किया उसको चला बट डेंटिस्ट्री में चलेगा क्या? Does it actually make sense? Yes. How would you know it makes sense? Is you will prescribe one set of patients Tolib, you will not prescribe another set of patients Tolib, means you will divide the set of patients and you will see whether Tolib was effective or not. And this research was done in Savita Dental College. They found 60 patients who required disinfection. They divided them into 30 and 30, a category of two categories basically. 30 patients were given Tolib post-procedure and 30 patients were not given Tolib. They were given the regular antibiotics and painkiller. And they found out the patients who were prescribed Tolib post-procedure had less swelling, better healing, and when they were asked to grade themselves on the VAS score, that how much pain they had, they said they had less pain post-procedure when they took Tolib. So not just medical doctors, but our dentist community has also found out that Tolib is helpful. Now, when would you prescribe it? Tolib is helpful, I got it, but when should I prescribe it? Whenever you assume the patient might have a traumatic injury, either he had an injury or you created one during a procedure. It can be a response to edema or inflammation. So basically any surgical extraction, implant placement, disimpactions, wherever you're seeing delayed wound healing, patient had a trauma outside, anywhere where you feel there is inflammation and you want to reduce swelling, I would suggest go in and prescribe Tolib. Now, what is the dosage? The dosage is twice daily as long as required. But what does as long as required mean? If you see, most of our disimpaction or third molar extraction patients, they have pain for say 5 to 7 days. So that is the duration I personally prescribe it for. Wherever I do a major surgery, maybe a GBR or something where there is a direct sinus lift or something of that sorts, I prescribe it for maybe a period of 10 days because I know the swelling and inflammation might last a bit longer. And I have personally found in the cases where I have prescribed Tolip, the swelling is lesser as compared to the patients I do not prescribe it. Now the point is, what are the side effects? We know the advantages, we know when to prescribe it, but what are the side effects? Remember your pharma classes when they asked you what the side effects are? Your answer was what always? Nausea, vomiting, diarrhea. Similarly, for the Tolip combination, the most common side effect is nausea, vomiting, and diarrhea. But are there situations you should not prescribe it? Yes, there are two such situations. First, if the patient is already on some anticoagulant or antiplatelet therapy like warfarin. Remember in the start we told bromelain, how does it act? It acts by preventing fibrin formation activity. So if the patient already has a disorder related to it, you will not prescribe it. Or if they are on a sedative drug. The second case where I do not prescribe Tolib is pregnancy and lactation. Actually, there is no research which says Tolib is unsafe for pregnant women or lactating women. But we do not have adequate research saying it is safe as well. So as dentists, we should always be on the safer side and we can avoid it for now. Later, since we know it comes from commonly used sources, if there is studies saying that it is safe for pregnant and lactating women, we might be able to prescribe it later. But in all other cases where you're doing a surgery, you're expecting traumatic response, that is inflammation, swelling or pain, then prescribing Tolib would be an added advantage. Why I prescribe Tolib and not the rest of the medicines out there? You might have heard the recent incident of a syrup company where syrup was supplied. You might have generic drugs, but the problem with generic drugs is we do not know how they are sourcing their material from, where they are sourcing their material from, and what the reactions is to those chemicals out there. Whereas in Tolib, we know we are getting it from a reputed brand, Hetero Healthcare, who have their centers across more than 120 countries, I assume. Okay, so if a company with such kind of backing is coming up with a drug which we know will help reduce the discomfort in our patients, then what is stopping us from doing it? Because as we discussed in our start, our aim is to have happier patients. And happier patients, what do they want? Less pain and less discomfort. With that, we'll open the session for any questions.
Thanks, Dr. Satish. Participating doctors, if you have any question, you can type in the chat box. Questions will directly reach to Dr. Satish. There's a chat box below. You can type in your questions in the chat box. Dr. Satish will answer it. Doctors, if you have questions, you can type in. I guess so far so good. Thank you, Dr. Satish, for your valuable time and this wonderful session, enlightening session, and a detailed webinar. I hope this will clear a lot of doubts about Tolib and Papen as an enzyme and help all the doctor fraternity to prescribe it more. Thank you for a valuable time, Dr. Satish.
Thank you.
Thank you so much. Yeah. We end the session here. Thank you.